some things I noticed right away. And I definitely had more patients using Invisalign that were using AcceleDent than I did in full fixed when we first started. And part of that was I knew right away that I could tell my Invisalign patients that if they bought an AcceleDent unit, they could go from switching those aligners every 14 days to switching them every 7 days, or from 10 days to 5 days. And of course they can do the math, and that means that we finish twice as fast as we were going to finish without it. So we found acceptance from Invisalign patients was high very, very quickly. I also found right away that teeth were tracking much, much better. Patients had no problem switching every 5 to 7 days. They were telling me they were so loose they were falling out at the end of that term. And everyone said they felt great. So teeth felt better, especially those who started without it, got the AcceleDent partway through. They reported comfort more than anyone else because they knew what it felt like to not have a unit and what it felt like to have a unit. And so it was great to have a handful of those, because people who had never had teeth moved before wouldn't necessarily know what that would feel like without an AcceleDent. And at that point, probably by December of 2014, I decided that I really, really wanted everyone in Invisalign to have an AcceleDent, because I was getting frustrated with those who weren't using an AcceleDent with things not going exactly as I wanted them to. I seemed to be having less trouble in general with those that were in an AcceleDent. I'm going to show you a few of my Invisalign cases here. This is Lindsay. She is a 31-year-old female, and she came in simply worried about crowding. As you can see, we've got a narrow maxillary arch, we've got an anterior open bite, and we're class 3 and we're crowded. She was also getting married, and so we were in a rush. So she was one of my early takers on an AcceleDent unit, and she was in treatment for 10 months total time. Her initial ClinCheck came back with 35 aligners. She was switching once a week. I tried to get her to switch every 5 days, but she liked switching on the same day of the week every week, so my arguments were futile there. So she liked Fridays as her switch day, and we stuck with Fridays as her switch day. She wore class 3 elastics for me. We did not do any IPR. I don't do a lot of IPR, so you'll see that as a theme here. Her refinement was 8 aligners. We just had 1 refinement, and she was a very motivated, very compliant patient. This was where we ended up. This was one of those cases when I looked back at the photos, I went, wow, well, that turned out better than I thought it was going to. Lindsay did a great job, and this is one of my, I think, good examples of what compliance combined with some good planning will do for you. I find I struggle with adults in the class 3 sometimes, and this one went incredibly well, and Lindsay was thrilled, and she was one of those people who said nothing ever hurt. It always felt fantastic. This is Emily.